Hello everyone, welcome to today's video. I'm Dr. Andrew. I'm an internal medicine doctor specializing in diabetic care. As we all know, diabetes is a lifelong condition and can cause many health problems. A lot of patients worry about its complications. But the good news is that with the right knowledge and early actions, many diabetes complications can be prevented or slowed down. Today, I'll be sharing what are these microvascular complications, why do they happen, and most importantly, what can you do to protect yourself. Microvascular complications refers to the damage to the small blood vessels in the body. When we have high blood sugar in our body, over time, they can injure these tiny blood vessels, thereby reducing blood flows and oxygen to the important organs. And they mainly target the eye, causing retinopathy, the kidney, causing nephropathy, and also the nerve, causing neuropathy. Please be aware that these complications don't appear overnight, but they develop slowly. And the encouraging part is that early detection and good diabetes control can dramatically reduce your risk. Let's start with the eyes. When we have diabetic retinopathy, the high blood sugar in our body will damage the small blood vessels at the back of the eye. Early on, you may not have any symptoms at all. Many patients can see and feel perfectly fine. But as time progresses, these damaged blood vessels can leak, they can bleed, and grow abnormally, leading to blurred vision and even blindness if left untreated. You can see here, as the disease progresses, you may start to notice changes such as blurred vision, dark spots or floaters. You may even feel difficulty to see at dim lightings, especially at night. You may also have distorted visions. And in very advanced disease, there could be a sudden visual loss if bleeding happens inside the eyes. The key message is that we don't wait for the symptoms to develop, as this is dangerous. By the time the changes appears, the disease is already very advanced, and that is why a regular eye screening is absolutely essential for everyone living with diabetes. I advocate the patients to have regular eye examinations, at least annually. Keep your blood sugar and blood pressure in the target range. Next, we talk about the kidney, our natural body filters. Diabetes is one of the most common causes of kidney disease. It can actually cause protein leakage, which can be detected by urine tests, and we can also do some blood tests to test our kidney functions. Diabetes damage the kidney by damaging the tiny blood vessels inside it. Over time, the filters inside the kidney will become leaky, which means that protein can start to spill into the urine, and this is an early warning sign. If left untreated, the damage can continue to happen. The kidney will gradually lose the ability to filter waste and eventually leading to chronic kidney disease. As I've mentioned, in the early stage, you may not feel any symptoms. Most of the people only notice symptoms and problems later on during the disease, such as the high blood pressure. They may have swelling over the legs, they can have trouble breathing, and even cramps over the muscles. And the good news is that there are certain medications and newer drugs that can slow down the kidney damage significantly. Please also do a yearly kidney test and also keep the sugar and blood pressure under control. Finally, we're going to talk about the nerve damage, neuropathies, which can be also caused by diabetes. The high blood sugar can cause damage to the nerve, especially in the feet. We can think about this high blood sugar like the sticky syrup that flows through the blood vessels. Over time, this can cause stiffening and also narrowing of the blood vessels, causing inflammations and damage to the nerve surrounding. People can actually notice burning pains, muscle weakness, numbness, or even slow healing ulcers and foot sores. So these foot ulcers usually start as a very small break in the skin, and if left unnoticed, it can actually progress into a deeper wound involving tissues, tendons, or even bones. If these are left untreated, infection can become severe, sometimes leading to hospitalizations, and certain cases can even lead to amputations. And that is why foot care is very essential. Daily checking of the feet is important, and also keep the nails trimmed safely, wear a proper footwear, and also please seek for medical attention immediately if you notice any break in the skin, as early treatment can save your foot and even save your life. Before we finish, I want to leave you a few key messages. With the right informations, regular screening, and consistent daily habits, you have the power to protect your own self, especially your eyes, your kidneys, and your nerve. And please take note that if you have diabetes, you are not alone. Work closely with your healthcare team, ask questions, take things one a day at a time. Early actions save sights, save kidneys, and save life. Thank you for watching, and I hope this video helped you in managing your health. Stay well and take care.